The Kenya Medical Supplies Agency is today delivering drugs worth 100 million shillings, but supplies in recent years have been erratic, causing untold suffering to patients who have to buy medicine in private pharmacies. But just why are public hospitals perennially lacking the drugs? Miriam Nyambura is speaking with KEMSA and county health officials in Nakuru. Marianne, what's the latest from where you are?
Well, Trevor, indeed, the situation here is that the KEMSA is set to transfer the drugs to the different dispensaries and hospitals here in Nakuru County. This amid claims and concerns from the residents that the drugs are not enough in the hospitals. Spot check earlier on because they do this year in, year out in a span of in like 3 times in a year. So the question begs, is the county government under applying for the medical supplies because of such concerns? But I will be posing these questions to the officials, starting off with the county CEC Health. Maybe you could start off with your name kindly and tell us, is the county government under applying for the drugs? Because we've seen cases such as in Kuresoi North, Kuresoi South, as well as Molo, and even at the PGH hospital, whereby there are concerns that the drugs are not, the patients most of the times they are told to go take drugs from private pharmacies. Is that a main concern? Is the county government under applying for these drugs?
I'm hearing that one for the first time. It is indeed true that the county government of Nakuru buys medical supplies from KEMSA every quarter, the whole year, and we use about 500 million Kenya shillings to buy pharmaceutical products. And we use what we call a pool system. A pool system is where a facility sits, depending on its level, whether it's a dispensary, a health center, a level 4 or a level 5, they decide on the medicine that they require as per their workload and the level of service delivery, and they order. And the order goes straight to KEMSA, and KEMSA delivers straight to the facility. So the issue of a surprise does not arise. What might arise is because there is a national policy on what supplies should be in what level. For example, you don't expect a drug like insulin in a dispensary. You don't expect cancer drugs in health centers or dialysis medicine in a level 4 facility. So that is the apparent lack of drugs that you hear of. Otherwise, as I speak now, we have all the medicines that we require per level of facility, and this is just, we haven't run out of the medication. This is just to fill up so that we can run the next quarter. Yes.
Maybe you could tell us the situation of pending bills. Is there in any way that 100 million shillings is just not a small amount? So does that mean that the county government has already paid that amount to the KEMSA officials, or it's yet to pay?
KEMSA is here well represented and they will speak for themselves, but at least you can hear from me. We have no debt at KEMSA. We've paid everything except this one, which we are receiving now and we shall pay. We are, I should think we are among the best paying counties in this republic. And being able to do 500 million to about 600 million per year is good enough. That takes care of our clinical services. But of course, as a county, we are insisting on promotive and preventive health services so that people don't come for treatment. But certainly people will always get sick, and that is why we are ready enough as a county to make sure that the medicines that our people require are available.
Allow me to take you back to a few weeks ago, whereby there was a case of 3 people actually, there were allegations that they died as a result of malaria in this area. What more needs to be done to ensure that these cases are not that rampant in Nakuru? Because it's a case that we've not heard of in the past.
Yes, that is a new occurrence. But if you know the geography of Nakuru, that area is neighboring Baringo, where there was such an outbreak too, and people move across. And of course, you know, epidemiologically, this is not a malaria endemic zone. And you know, because of, you know, malaria endemic zones are like Nyanza, Western and the coast, where people have some partial immunity because malaria exists there all the time. This is a highland area, and therefore due to the weather changes and the climate change, we are seeing also new patterns of disease distribution, and our people are not immune to malaria. So when they get malaria, and of course the few people who passed on, we had a problem of coming a bit late to seek for health services. Yet we have all the medicines and the staff in that area. Yes.
Thank you so much. Briefly, Trevor, I will be speaking to the KEMSA official who will just tell us more about this. We've seen this is the third time this year that you've supplied the medical supplies to Nakuru County. Maybe what is the situation, and are there cases of other counties even having pending bills? They've not paid their bills.
Yeah, I want to confirm that Nakuru County indeed is able to meet its obligations in time. And that's why we have always been doing timely supplies to the county, because unlike other counties, there are some that have pending bills, and that has been making us not to supply them. And Nakuru County is one of our best counties, and anytime they want the drugs, we are able to serve them efficiently. Yes.
Maybe you could tell us a very big issue here is the universal health coverage. You've seen it being rolled out in 4 different counties. But as a result of that, how is the medical supplies related to this? Are we able to ensure that at the end of the day, within the 4 years, that generally all counties will be able to adapt to the universal health coverage?
Yes, indeed, because KEMSA is committed to efficiently supply the affordable Medicare in terms of medical commodity supplies, and we're also looking forward for the UHC so that we can be able to implement the Big 4 agendas prescribed by the President of this nation. Yes.
Allow me to take you back to the pending bills. How much are we talking about that some counties have not paid their bills in general, and how is that affecting the medical supplies in the different counties?
As we speak right now, I may not have the whole figure, but I know because this is all about pool system. It's a cycle that goes around, so you pay so that you're able to procure for another county. So this can really affect the KEMSA operations, because if the pending bills are not paid in time, it will mean there's a county that will be affected, or there are some items that will be affected that may not be bought in time. And that will affect the stocking of drugs to other counties. My name is Maina Dinguri.
Thank you so much. Well, Trevor, there you have it. That is the KEMSA official mine, as well as the health CEC, just shedding more light about this whole issue. Rather, in the next few minutes, we expect that the over 100 million shillings worth of the drugs will be flagged off and taken to the different areas. Some of the areas, including the Nakuru Level 5 Hospital, Molo Sub-County Hospital, as well as other dispensaries, even in Naivasha and Nakuru County in general. The KEMSA official insisting that, of course, there are counties which are yet to pay their bills, which is really affecting the operations and supplies of the medical drugs to the different areas. Back to you, Trevor.